I am a family and community medicine physician. I am the medical director at Sacramento Native American Health Center, and I provide primary care services from pediatrics to geriatrics. When you are presented with a patient that clearly is in need of help, but you're having to wait for records to determine the next step, it doesn't necessarily hurt me individually, but the patient is potentially hurt significantly as they wait. I had a patient who I saw last year who said, yeah, I was in the hospital and they said I had a stroke. In my mind, there's certain things that I think that the patient is going to need after having a stroke. What medications do they need? Are there specialists that they need to be following up with? I requested the records 3 or 4 different times and did not get them. And waiting for those things, that was 3 or 4 months that the patient wasn't able to get those services. I still followed the patient and he still has limitations that I'm not convinced he would have had otherwise. The number of times in which we get the same labs over and over again, simply because we don't have access to the labs previously, or there's not an easy health information exchange to import those labs into our system, is ridiculous. Simply trying to get the records from outside entity or get a referral through is a painstakingly slow process. And in the meantime, the patient is the one that's suffering.